your goal is to raise your vitamin D level. And let's say that you learned that your friend Mary, she had low vitamin D level before too. And what she did to get that level up is she started eating more fish, she started eating more eggs, and she took a tablet of vitamin D. So you choose to do what Mary did, and you're like, okay, in 3 months, I'm going to retest and see where my blood level is at. So you reassess, you do the blood level again. Even though it worked for Mary, whenever you retest it, you saw that your level was still 36. It didn't budge a number. It didn't budge an inch. So now what do you have to do? You've done your reassessment. Now you need to troubleshoot. Welcome, everyone. So today I'm going to talk about the most common missing parts of these cancer recurrence prevention plans or cancer blocking plans that we see, whether people are putting stuff together on their own or if potentially they're working with other practitioners on how to optimize their health and reduce the risk of cancer coming back. Today, I want to highlight the areas that are just kind of gaping holes that can be easily fixed if we just apply two things. Specifically, these two things are reassessment and troubleshooting. So that's what I'm going to talk about today. I'm going to go through how reassessment and troubleshooting helps to create a plan that's more effective against cancer. I'm going to talk about how to reassess more effectively, how to troubleshoot more effectively, and some examples of reassessment and troubleshooting so you can get to see what exactly do I mean? How do we put this into your life? How does this apply to you and your plans? You'll get to see it more effectively as well whenever I put it together in the examples that I'll provide. So overall, what I'm hoping to achieve here is that I answer some of these questions that are very much prominent in the cancer recurrence prevention world. Some of the confusion that is going on, such as like, is what I'm doing actually working? I'm sure you've asked yourself that question before. Potentially you're taking something and you're like, is this the correct dose? Is it truly working for my body? And do I need to increase my dose or reduce my dose? Kind of like, what do I even focus on? Like, what in my body even needs support? What do I even need to do? And then also, like, we have so many people who come to us and they're like, so I'm taking these dozen supplements. And we're like, when did you start taking these? Like, well, I started taking it at the beginning of chemotherapy or the beginning of my treatment plan. And they're still taking it potentially even a year or two post-treatment. And what is applying to them during treatment is not necessarily going to apply to them after treatment. So if you have that happening as well, if there's something you're like, well, I've been taking this forever, is it still actually doing anything? I'm hoping to kind of give you some clarity around that today as well. So I know it's not something fancy where we're talking about a specific intervention necessarily that's going to help to block cancer, reduce recurrence risk, but this, honest to goodness, is one of the most important parts when it comes to analyzing what is best for you. And even though it's not fancy or sexy, so to speak, this is going to be ridiculously important to helping you to reduce your recurrence risk and to create this plan that's going to be super successful for you. All right, so let's jump into it. The first thing I want to say is that reassessment is to ensure that the plan is working for you. And troubleshooting is how to ensure the plan will work for you. So again, reassessment is to ensure that the plan is working for you. Troubleshooting is how to ensure that the plan will work for you. And we're going to go through both today. You basically need to reassess because even if you had the same diagnosis or the same treatment plan as someone else, your recovery plan is not going to be the same. Your prevention plan is not going to be the same. In active cancer, the goal truly is to kill cancer cells. And you really can do a lot of different things to kill cancer cells, but not as many things as you can do to prevent cancer from starting or growing. Because in preventing cancer from starting or growing or coming back, then we really need to change the environment in the body. And the idea is that we want to change the environment so that cells don't get these signals, these hits to them that are going to cause them to develop into cancer. They don't get the fuel that they need to grow. They don't get they don't lose the ability to repair themselves, to make them back to normal cells, that they get the ability, basically, we want them to be able to reverse themselves back into normal cells and not continue on to be more cancer cells. This is due to the environment. So again, when we're going through active cancer treatment, we want to kill the cancer cells because they're there. But post-treatment, when we're looking at keeping cancer from coming back, it is less about killing cancer cells for many reasons. One of them being that you've probably killed the majority of the cancer cells if you've gone through treatment. Yes, we can get into cancer stem cells, but maybe not today. It'll be definitely a topic for another podcast episode. But whenever we're looking at post-treatment, the cells are gone, let's say, there's nothing left to kill. So we need to focus more on the environment and ensuring that we're not creating more cancer cells, that if there are any pre-cancer cells there, that they're able to heal themselves, and that if there potentially are some cancer cells hanging out, we're not giving them the fuel to grow. So it's a different mindset switch here. And your environment in your body is different than someone else's, right? So your ability to process things, whether it's through your liver, your kidneys, the foods you're taking in to extract vitamins and nutrients to absorb them, that's all different. And it has to do with basically your blueprint of your body. And you're going to hear me talk about epigenetics now and then. And your blueprint is your epigenetics, your genetics, things like that. So whenever let's say your name is Mary and my name is Megan. So Mary, you'll have different ways to extract the nutrients from your food and absorb it. Like your gut microbiome is different. Your genetic abilities to create things, to break things down is going to be different than mine. So the environment in your body is going to be different. All right. I hope this is making sense so far and is ringing a bell. There are many different things that we want to apply when it comes to creating this environment in your body, but these are things that I'm going to cover in pretty much any episode I ever do. And the things that it's going to be that's relating to this episode today is that whenever it comes down to it, we need to apply something and then reassess, because when we reassess, we can figure out, is it working? And then let's say it's not working, then we can troubleshoot and we can figure out different ways to troubleshoot to make the plan work for you. All right. So this is why today is very important, is because your environment is different. Recurrence prevention plan is much different than just killing cancer cells. And in order to ensure that your environment and the things that we're applying to change your environment are working, we need to reassess. And then if we find out after a reassessment that it's not working, we need to troubleshoot. All right. So the first part of reassessment is actually assessing. So the first thing we need to do is to determine a plan and figure out if it's going to work for you. We really need to get to know you. We want to know your blueprint. We want to know the environment. We want to know the factors about your health and history. And I'm not going to talk about that specifically today. I've already spoken about it quite a bit, actually, whenever you go back through my episodes on blood work and testing. This is how we get to know you a little bit better, and how we just gather some data and details. We align that as well with your past medical history, with the type of diagnosis that you received, and is there anything in particular that might cause that type of cancer? Any sort of hormonal patterns, stress patterns, environmental contaminants, things like that. We can gather all of that and kind of start the initial assessment and figure out, where do you want to start? What interventions do we want to choose to begin with, basically? So once you put the plan into action, though, we don't want to just assume that it is working for you. We really want to check if it actually is doing its job, and that it matches your needs, that it matches your blueprint, that it is actually working for your body. And this is the reassessment phase. So first we've reassessed, we've done your blood work, we've done your epigenetics, we gathered your health history and your diagnosis information. We put a plan into place. Then we want to see, did it work? And we're going to reassess, okay? Reassessment is super important, and it is missed so often. Like, we have women all the time who they say they went to see a practitioner, a functional health practitioner, naturopathic doctor, whatever it might have been, and they were given 5 supplements and sent home. And then a couple months goes by and they're like, I wasn't told to rebook an appointment. I don't know if these are actually working. Actually, I'm post-treatment now. Should I change things up? So it's really important that you check in with your practitioner again to get that reassessment into place. So even if they don't mention it, you can take the autonomy, take the action yourself and go and rebook with them too, just to get another feedback on, like, here's where I am right now. Should I continue on with this or not? Because your body is going to change over time. Even if something worked last year for whatever you were trying to tackle, it might not work now because maybe something has changed and something else is now contributing to the discomfort or symptom or whatever it is that you're trying to work on. hormones shift, your stress levels will go up and down. Bodies adapt as well. Your body is very adaptable, and then it'll kind of start to ignore certain things that you might have put into place and come up with other things that it wants you to work on. So reassessment is basically how you can stay current with your body's shifts and also with the different stages of care. Because whenever you are going through treatment, whatever you were given to support yourself during treatment, whether it was to manage the side effects or to be more cancer killing or to improve the efficacy of your treatment plan, whether it's chemo or radiation or whatever, make them work better, it could be different once you're post-treatment. Or even if you're in chemo versus radiation, you're going to have different interventions at that time as well. And it's important to reassess because potentially it might not be as effective anymore. It could even be interfering with some of your treatment too. So you want to check in to see what can we do to give you the optimal plan at the time that you need it, basically. The other thing is that reassessment can avoid a lot of wasted effort, time, money. If you don't really reassess, then there's this risk of pouring all of this energy and potentially money into things like supplements or specific diets or tech or whatever it might be. And it might not actually be moving the needle. And until we reassess, we don't really know, is it moving the needle or not? We want to see if it's working, and we want to be able to see if it's not working. We want to be able to course correct very quickly so we can get you into the right flow of things that is actually going to work. So let's talk about how to reassess. And I'm just calling everyone back in here in case you drifted away. I know I do speak very quickly as well. I'm going to try to slow down. But I'm calling you back in here right now because these are very important steps. I'm going to talk about 3 specific ways to reassess. And I want you to start to use this information to analyze your own treatment plan to see, is there anything that you can do to reassess more effectively and make sure that it's working for you. All right. So part 1, we kind of talked about you need to start at the beginning. You need to assess before you reassess. So before you start initiating any changes, I want you to make sure that you set up your assessment properly. You get all your data, you choose an intervention, and then you carry forward. But let's say you're carrying it forward. Now we need to reassess. So the first step of reassessing is to basically outline what is your goal and what are the symptoms that you want to resolve. So we're going to go into the details behind your goal, the details behind whatever symptom or whatever it might be, whether it's we're talking about maybe you have hot flashes or high cholesterol or low energy or brain fog, or you're legitimately just trying to keep cancer from coming back. These are all your goals, and we need to dig in deeper to analyze those goals. What do they mean to you? How are they affecting your life? What can we assess basically in order to make sure that they're working? So what do you want to change? Do you have low ferritin on your blood work and we need to bring the iron back up? Do you, again, have hot flashes and they're 5 times a day, they wake you up at night, you have to change your clothes twice a day? These are all the details we want to gather so that we can use them to reassess after applying an intervention, make sure that it's working. All right. So do you have objective markers? Do you have blood work? Do you have subjective markers like your symptoms, the intensity of things, the frequency of things? How are they impacting your life? You want to get a little journal together and you want to write down all of these details because I tell you, I describe a lot of health changes like day turning into night, where sometimes it's twilight, you're going about your day, it's still a little bit bright out, and then all of a sudden you look outside and it's pitch dark. And that transition happens so slowly and gradually over time that sometimes you don't even notice the difference and all of a sudden it just happened. So if we're looking at your health interventions and you are changing something and you are basically looking at where are you right now and it's impacting you this way, and then you apply an intervention and you're reassessing like a couple months down the road, you might not even notice throughout the couple of months up to the time that you notice the change that anything has changed. But then you truly dig in, reassess. So let's say you did your journal and you analyzed all of your hot flash symptoms at the very beginning before you made any change. And then you apply your change and you go through a couple months, and a couple of months later, you're like, well, I still feel like I have a hot flash now and then. But then you journal it all and you realize, oh, now I only have hot flashes once a day. Now I'm sleeping through the night 5 or 6 days out of 7. I don't have to change my clothes anymore. And then you compare it to your initial notes where you're like, I had to change my clothes 2 times a day. I wasn't sleeping. The hot flashes were so intense, so frequent, and now it's much better. And because it happened over such a long time sometimes that you forget how bad it used to be, and you're like, you didn't realize that your intervention actually did work. So it's really important to compare your day to your night, and see what is the difference after your certain time period, because it just gives you this sense of, yes, it did work. And sometimes we just miss that it did work sometimes. So we want to really analyze that and journal things in the very beginning and then reassess over time and journal them again. I kind of went off topic there, but just to kind of bring it back. So your first step of reassessment is first to have your goal outlined, your symptom outlined in great detail. Everything from the intensity, the frequency, the blood work markers, whatever it might be, because you're going to use that to reflect back on in a little bit. Also, I want you to think about this. So what does success look like to you? Does it look like it's 100% resolved? Does it look like it's 50% resolved? Because that can be different from everybody. So maybe if you still had a hot flash every day, that would be devastating to you. So maybe you want to, and that would be completely okay for someone else. So I want you to analyze, what does success look like for you? Because this gives us the working point that we want to work towards, that it gives us our goal, our motivation. That's what we want to see you achieve whenever we know that something is actually successful, that whatever intervention you applied is actually successful or not. Okay. So let's move into the second part of reassessment, which is to decide on and fully understand your intervention. You want to know, whatever you choose to resolve your symptom or achieve your goal, how long should it take to work? How consistent do you need to be with this change that you're applying in order for it to be successful, in order for it to work? And how well is it expected to work? And again, I'll go into better examples of this in just a few minutes. But just to kind of put it out there. So how long does it take to work? Let's say that you're expecting to change your cholesterol markers. And so cholesterol markers with diet changes tend to take, they say in conventional recommendations, about 3 months. To be honest, I find that it takes about 6 months for us to truly see a budge on blood work that is drastic enough to say, yes, it is working, because it takes a while for people to put the intervention into place. Your body's, it's not just going to work the next day you start a diet. It takes some time. So I find intervention for cholesterol could take up to 6 months to truly see an impact, where we want to say it's working or it's not working. What we don't want to see is it getting worse at 3-month mark. We want to see it at least staying the same, if not getting better, but it should be very much better at a 6-month mark if we're doing dietary interventions, for example, for cholesterol. But so whenever we get the objective markers on your blood work, we want to change the cholesterol. We want to change that by a certain dietary plan. Maybe it's a Mediterranean diet for ease of explanation here. So you're going to apply the Mediterranean diet. You know, it takes about 3 to 6 months for the dietary changes to impact your blood work. So you're going to reassess your blood work at 3 and 6 months. It's expected that the Mediterranean diet could potentially even give you 100% resolution of your high cholesterol, where your cholesterol markers get back into normal. That's our expectation around our intervention. And potentially we might see a difference in your energy as well. So your energy is now 4 out of 10. We're going to aim for an 8 out of 10 energy change when it comes to lowering your cholesterol and going on this Mediterranean diet. So we've reassessed, we added some numbers, we have some markers to go by in order to see, is this intervention actually going to be working? We got our timeline. All these are important. And then we want to decide how we're going to reassess. Like, when are we going to reassess? Again, we're looking at a 3 to 6 month timeline, for example, for cholesterol. How are you going to do it? Are you going to fill out this journal that I suggested at the beginning? You're going to get your blood work done. Are you going to keep all your markers in one place in a Google Drive or something like that, so that you can keep checking in on? Figure out, how do you want to record what you're doing to make sure that it actually is working. And I just want to put in a slight caveat that we can't measure everything. Like, for example, we can't 100% be sure, is cancer in the body or not. There are some ways. We can look at ctDNA testing. We can look at your scans and make sure that they're staying clear and empty. But we want to measure more than what is typically done. There's definitely a lot more that we can do above and beyond. We'll see you in a couple months. Good luck with your nutrition, exercise plans. You guys know the spiel, right? There's definitely more we can do. And whenever we're looking at reducing and measuring recurrence risk, we actually don't necessarily need to look at cancer in particular, again, if we're looking at the environment of your body and how it might be conducive or not conducive to cancer starting and growing, we're going to be measuring your blood sugar, your inflammatory markers, your cholesterol markers, your vitamins and things like that. So we're measuring the environment and trying to make it not conducive to cancer starting and growing. That's how we're looking at measuring cancer recurrence risk over time. I hope that was helpful there too. So let's say you did these three things. You outlined your goal or the symptom that you want to resolve. You wrote it down in detail, how you're experiencing it right now with your objective and subjective markers. You've decided on your intervention. You know how long it should take for the intervention to work. You know how effective it should be. It should resolve things 100% or 50%. You know you need to be consistent with it every day in order to make a difference, or you need to do it at 5 times a week in order to make a difference. You've decided on how you will reassess. You will redo the blood work. You will relook in your journal and answer the same questions again. You know when you're going to do it, all those kind of things. Let's say you do the reassessment. You did a really good job at reassessing, and now you know that things look good. Your cholesterol did change. The intervention of Mediterranean diet did work. That is fantastic. That is fantastic. And I feel like we sometimes ignore these things and skip the celebration. And I just want to let you know that if you see anything fantastic on your blood work, even one marker has improved, you should be celebrating this because it's training your brain to pull yourself out of the negativity and the awfulness and the stress and all those things when it comes to cancer. And even just focusing on one good thing and just celebrating that one good thing is going to give you huge improvements overall in how you feel in other parts of your body as well. So I want you to celebrate anything good that happened and not just move on to the next thing or, oh, but this looks good, but you know what? This looks awful. Like, you really need to start focusing there. You're going to be like, this looks good. Hallelujah. I'm going to go buy myself a house plant or whatever you want to do to celebrate. And then you can move on afterwards to the next thing you want to work on if you want. But I just really wanted to point out that you should be celebrating your wins too, because geez, like there's so many bad things that can happen. Let's really focus in on the good things too and celebrate. We just don't see enough of that. Okay. So let's say you reassess, you retest, you know you did your reassessment right. Everything should have worked, but it didn't. What do? This is where we move into troubleshooting. And troubleshooting is really fun. Actually, it can be fun for us as practitioners, and it can be frustrating sometimes if you don't have the right mindset around it. But let's talk about what that mindset might look like. So just to kind of recap, we did reassessment there. Those 3 things were to outline your goal, your symptoms, really get to know them, really get to write things down. You're going to decide on your intervention and how effective it should be, timelines, things like that. And then you're going to decide how to reassess, when you're going to reassess, what markers you're going to use to reassess. That's all reassessment. We really need to make sure that happens. So you reassess, it looks good, you celebrate, you reassess, maybe there's some room for improvement. We're going to troubleshoot and figure out, why didn't it work? What can we do in order to make it work? Because whenever you have a goal, like if you want to increase your vitamin level, you want to resolve a symptom, you want to change a pathway that could be conducive to causing cancer, I always say, for lack of a better saying, a better way to say this, and if you can think of a better way to say this, please send me a message on Instagram. I would love a different story of how to say this because it sounds awful. But when it comes to figuring out how to resolve a symptom, there is more than one way to skin a cat. And I don't like the visual that creates, but there is more than one way to skin a cat. So if you're looking to raise a vitamin level, you apply an intervention, it doesn't work, there's going to be another way to raise that vitamin level. There's another way to skin that cat. And again, send me a DM on Instagram if you can figure out, or put it in the YouTube channel comments or whatever. I would love a different way, a different expression. Then there's more than one way to skin a cat. So let me know. So let's go through what that might look like. So let's say you did your initial assessment, you did your blood work, and you found out that your vitamin D is a suboptimal level. It's 36 and you want it to be closer to like 75. Let's say that's what we're looking at here. Now, your goal is to raise your vitamin D level. And let's say that you learned that your friend Mary, she had low vitamin D level before too. And what she did to get that level up is she started eating more fish. She started eating more eggs, and she took a tablet of vitamin D. So fish and eggs, they're more rich in vitamin D. And she also decided to take a little white tablet of vitamin D each day. And she saw that her levels went from in the 30s whenever she tested her blood work to about 60. And that took her about 3 months of eating the fish eggs and taking that tablet of vitamin D. So you choose to do what Mary did. You chose the intervention of the fish eggs and the little tablet of vitamin D, the same one that she bought. And you're like, okay, in 3 months, I'm going to retest and see where my blood level is at. So you reassess, you do the blood level again. Even though it worked for Mary, whenever you retest it, you saw that your level was still 36. It didn't budge a number. It didn't budge an inch, basically. So now what do you have to do? You've done your reassessment. Now you need to troubleshoot. And troubleshooting will cover things like, did you actually eat the fish and eggs every day? We were like, not really, but didn't eat them regularly. Some weeks I went and didn't even have any fish whatsoever. I probably didn't really achieve the vitamin D levels through foods that I could have because I don't like them. So troubleshooting is about, well, let's figure out something that you do like instead. Maybe that dose didn't work for you either. Maybe we need to increase the dose. Or maybe your blueprint in your body is set up in a different way where you don't absorb the tablet form of vitamin D very well. Maybe you need a fat-soluble form of vitamin D because vitamin D is a fat-soluble vitamin. It does like some fat in order to be absorbed into your cells, into the body where it's needed to actually raise your vitamin D levels. So these are kind of some thought processes to have whenever you're troubleshooting. 1, did I actually follow the intervention appropriately? 2, did I like the intervention? Was I able to make it work for me? 3, was it the right dose? Was it the right form? These are all parts of troubleshooting. And really it is your way to make sure that your plan's going to work for you. It is the other way to skin a cat. Awful story. All right. So basically, troubleshooting will turn this sense of frustration into clarity as well. This is the mindset switch that I want you to have when it comes to your plans. Instead of thinking that nothing works for me, it's just I'm screwed. It's just not going to work. You're going to reframe this as a data point. You now know that this intervention isn't going to work for you. It didn't budget. So we need to know that we can cross those things off our list and move on to the next part of our troubleshooting plan. Instead, we're going to switch to a fat-soluble source of vitamin D, and we're going to increase the dose in order to get it up. It also helps to keep your plan realistic because often what looks good on paper will hit kind of bumps in real life. Like your kids had extra soccer and you weren't able to prepare the fish that you thought you were going to be able to eat more often. You had to potentially eat out, or you had to have more sandwiches, or just not vitamin D rich foods because it just didn't work for your schedule. You had weird side effects where you tried to eat more fish, but you were getting fish burps and it was gross and you just didn't want to have that anymore, or was stinking up your house and the family couldn't stand having salmon one more time. So you had to switch to something else. It just wasn't working for you. Troubleshooting basically gives you that sense of flexibility without guilt. You know that there's another option available. It again is it's a data point. It's not a this failed. It is a data point. In conventional medicine, there's often a system to follow where like patient presents with X, we treat with Y, we expect Z to happen. In medications, conventional medicine can be very strong. They are able to kind of bypass the body's natural processes to push the body to do what is necessary. Whereas in natural medicine, holistic, whole body medicine, lifestyle medicine, nutrition, supplementation, all these kind of things, what the goal is to actually encourage the body to get what it needs to function optimally and to create a resolution of whatever symptom, or to just give you your goal. The way I see it is that conventional medicine is kind of like giving the person the fish, whereas naturopathic medicine is like teaching the person to fish. So, if you give a person a fish, they'll eat for a day. If you teach a person to fish, how to fish, they'll eat for their lifetime. So our goal with functional, naturopathic, holistic lifestyle medicine is to teach your body how to fish so that it can heal and it can create this pattern in your body for a lifetime where it's not conducive to cancer starting or growing. So that will take some troubleshooting that will take some effort to figure out what's going to work for you for the long run. And again, it's not a failure. It is par for the course when we're trying to figure out what can you be consistent with for your entire life and what's going to work for you, your life, your body, your blueprint, your genetics, all those kind of pieces. That's what holistic medicine really does. And nutrition and supplements and exercise, that's what that does. Okay. So just to, again, nail this home here is that troubleshooting is a necessary part of your plan. It's not a sign of failure or that you're doing the wrong thing. I mean, it can be the wrong thing, but you sometimes have to do that in order to know what the right thing is. Okay. Maybe your meal planning didn't suit your schedule, whatever. And this works whenever you're working with us as practitioners as well. We want to give you something to try being the key word. And now it's about your feedback, your reassessment, your troubleshooting, and we troubleshoot with you. So you didn't like those foods, didn't work for your schedule. Maybe that just wasn't the right food to change your blood work. That supplement actually didn't impact your epigenetics or your blueprint the way that we wanted to. So it didn't create the raised vitamin D levels or whatever it might be. We just need to change course, and that's okay. Okay. So let's get into some examples of reassessment and troubleshooting. I'm going to go back to the menopause one because it's a common thing that we see in our practice, whether it's from cancer treatment or someone just going through menopause. We work with a lot of women, mostly women. So let's use the example of hot flashes. So let's look at reassessment. Your goal, your symptom is hot flashes. That's what you want to get rid of. And your markers here to kind of get your starting point are that you have hot flashes 5 times a day. You have to change your clothes several times a day, let's say 3 times a day. You're getting woken up twice a night with hot flashes. The intensity is 7 out of 10, 10 being unbearable. So we got your frequency, we got your intensity, we've got how it's impacting your life with sleep and having to change your clothes. So we've now analyzed your symptom. We know that the goal is to get better than that. We want to get it less intense, less frequent, improve your sleep, those kind of things. Let's say the intervention you're going to choose is hypnotherapy. I don't know if you've heard of hypnotherapy for hot flashes, but it's very effective. In fact, it can reduce hot flashes like within about 8 weeks, basically. So you can actually see a reduction in the number of hot flashes, the intensity of your hot flashes within about 8 weeks. So that's our timeline, is we want to apply this intervention for at least 8 weeks. You would ideally like to see the intensity decrease, maybe 60 to 80%. So if our intensity is 7 out of 10, I'm not going to do 60, 80% on the fly, but let's say we're looking for an intensity of 2 out of 10. You get a little hot flash, you're like, that's a hot flash. That sucks. And then it goes away. So that's our goals. We want an intensity of 2 out of 10. Let's say you're having them 5 a day. So you want them maybe a couple times a week max or none. So we want our realistic goal, and then we want our best case scenario would be none. That's our goal. So we know that we have to do hypnotherapy, let's say 4 times a week for it to be effective too. So here are your markers, just kind of summarize. You have to do the hypnotherapy 4 times a week. We want an expectation of a number of hot flashes to be 0 to 3 times per week. The intensity should be up to 2 out of 10. Let's say that it's not waking you up anymore at night. And let's say that you don't have to change your clothes anymore. So let's say that that's your ideal expectation about this intervention of hypnotherapy. So we outline your goal, your symptom. We've outlined your intervention and the expectations around how to do the intervention and how effective it should be and you want it to be. Then let's reassess. So at your 8-week mark, because that's about how long it takes for the hypnotherapy to work, you're going to go back to your journal. You're going to see, you're going to write down again, how often are they happening? Are you waking up throughout the night? You're basically just going to answer all the same questions again to get an idea of, did it work or not? And I can't tell you how many times people just don't reassess. And like I said, you keep doing it forever and you're just constantly in this confusion zone of, is this truly working? Or the day-night effect that I described earlier, where things reduce so slowly that eventually you do get a resolution of the symptoms, but you had so much going on in the meantime that you completely forgot about it and your symptoms resolved, but you're still taking the black cohosh or whatever you might be taking in order to resolve the hot flash, or you still do the hypnotherapy even though you don't need to do it anymore. So reassessment, super important for let you know, can you just stop whatever you're doing? Because it already worked too. All right. And then let's say you don't see a change with the hypnotherapy, then we troubleshoot. We want to go on to something else. Let's go to our next best intervention. Let's say you want to try black cohosh, which is a type of supplement that can potentially help with hot flashes. Just a little side note is that we do want to be cautious about black cohosh in a hormone responsive cancer, but we have used it with some of our clients in the past, or recently actually, and to reduce their hot flashes just with a more individualized assessment there. But yeah, let's say hypnotherapy, you did it well, but it just didn't work for you. Now we're going to try black cohosh. You're going to give that another 4 to 6 weeks, see if that worked. Say if that didn't work, then we potentially look into medications or another natural intervention or whatever it might be. And I would say more times than not, we're seeing changes much earlier than an 8-week or 6-week mark, but we're kind of wanting to reassess along the way a little bit too, but really make sure that we're giving the intervention the full time that it is required in order to make a difference before we try throwing in something else. If you start putting too many things into the mix, you're not going to know what is actually working or not working. It's kind of like a scientific experiment where we just want to keep the variables very simple, very easy so that we can analyze what is working, what is not working. Okay. All right. Let's give another example here. Let's say I know a lot of your guys' goals are to keep cancer from coming back. Like that's your one and only goal. You don't really have any health concerns that you want to work on. So how do you reassess, analyze, troubleshoot if that is actually working or not? And it is a little bit more tricky, but some things that we can look at as some markers whenever we're setting up our assessment and our reassessment is we still do want to gather your blood work. We still want to gather your scans, make sure that they look all nice and clear. But you can even do ctDNA testing, which is like if you've heard of the company Signatera, Signater. That's one of the ctDNA companies that you could use. No affiliation whatsoever. We just appreciate what they're doing. We can gather these markers for sure and then reassess those over time. So you do a new scan, you do more a follow-up ctDNA testing, you look at your cancer antigen markers on your blood work, things like that. So that's how we can potentially analyze some recurrence reduction risks if that's your goal. I would say more often than not, we aren't using cancer as a marker of reducing recurrence risk. We are using research as objective markers. So we know that exercise reduces recurrence risk over time. So we're using exercise as a goal in order to achieve the overarching goal of reducing the risk of cancer coming back. So we know that you want use strength training 2 to 3 times a week, progressive overload, certain kind of goals within the exercise, consistency, those kind of things. So we're using that as a goal to analyze recurrence risk reduction. We're also, again, looking at the environment in your blood work. We're looking at your blood sugar, your growth factors, your vitamin levels, inflammatory markers, immune cell counts, things like that. We're tracking that every 3 to 6 to 12 months, depending on what your results are looking like, to analyze the environment in your body to make sure that cancer is not coming back. So it is a little bit tricky whenever we're looking at analyzing, assessing, and troubleshooting for recurrence prevention. But I want you to think outside the box and not just think about cancer as a marker. I want you to think more about the environment and how it's conducive to or not to cancer, getting its fuel, getting potentially hits to cells causing them to be cancer. We can use blood work and research markers in order to create your plan to be reassessed and troubleshoot it over time to make sure that cancer is not coming back. Okay. So whenever you're thinking, I tried the green smoothies, I tried all the supplements that everyone else is taking, everyone's raving about it, but I don't feel any different. This is where we draw back to reassessing. Are you doing the things that your body needs the most? Are we seeing changes in the markers? And if we're not seeing changes in the markers, we want to troubleshoot. So reassessment, troubleshooting, it really helps to separate the fad advice from what does your body truly need? What is actually working for you? We often hear like, I stick to things for a while, but then my life gets in the way, I fall off track, and we're bringing that back to how troubleshooting can help. So troubleshooting can show that even setbacks or changes, they're kind of part of the plan, and it's not failures that we need to troubleshoot. We need to figure out what will work for you. How can we make the plan work for you? Because there's more than one way to skin a cat. Other things are like, my doctor says my labs are fine, but I still feel awful, or I'm still unsure of what I need to do. And this is where reassessment kind of highlights the difference between normal and optimal. We want to achieve optimal. It allows us to look at just beyond the basic labs as well. We want to push past fine, and we want to kind of see, maybe it's not your labs we need to focus on. Maybe it is something else in order to make you feel not awful anymore too. Maybe we need to look at your nutrition, your exercise, your stress, things like that. So we've already analyzed that your labs are fine. Let's move on to the next part and analyze something else. Perhaps you might get overwhelmed because there is a lot to track. Reassessment can really help to narrow things down as well. So we see something looks great, we celebrate it, and then we move on to what truly needs help. So we can cut out all the stuff that maybe you're taking 5 supplements to improve your inflammation, but your inflammation looks fine. Let's now focus in on something that might require just a nutrition change or just one supplement. And maybe that's where we really need to focus your time and your energy. And then often we'll hear like, I'm scared that if I don't get this right, cancer is going to come back. How do I know if it's actually working or not? Whenever we assess and reassess, we can see things that look good and celebrate them, and really lean into the fact that they do look good, and have some confidence in certain areas of your life. And then we can really give you a focus as well, like I just spoke about, where we do want to focus your time, energy, attention, and we can kind of put you in that direction instead. So troubleshooting overall, it's not a failure. If you're working with a practitioner already and you're trying something and it's not working, they're like, well, let's try something else. It's not that they did something wrong or that you did something wrong. It's just, it is par for the course. We need to troubleshoot again, because we are teaching your body how to fish. We're not just giving it the fish. Hopefully you tuned into the earlier part of this episode to understand why I'm talking about fish. But we're really looking at creating an environment in the body where cancer doesn't want to be, or doesn't want to grow, and that requires assessing and troubleshooting. And just before I wrap up, I do want to let you know about my upcoming Blood Work Clarity Bootcamp. If you're listening to this before September 11th, 12th, 15th, and 16th, 2025, I do have a Blood Work Bootcamp coming up that I'm like ridiculously excited about. On this blood work, I'm going to teach you on this bootcamp. I'm going to teach you how to set up your assessment correctly. So your initial stages, where you can better understand what do you want to focus on, where do you need to put your attention. And this will allow you to also reassess and troubleshoot more easily over time too. So I'm going to teach you how to gather your data. We're going to walk through, what does the data actually mean? How do we make changes in order to optimize the data? Like, what does even optimal look like? And then you'll learn a little bit more about what are the best nutrition changes, best supplement changes to apply in order to improve whatever is coming back on your blood work that needs improving. So we're going to teach you how to dig into the environment in your body. We're going to look at everything from blood sugar and inflammatory markers, growth factors, things like that. We're going to get you that data, teach you how to get that data. And then what does it mean? And then what can we do in order to improve that data to create this environment where cancer doesn't want to be? So you can sign up over at flourisaftercancer.com/bootcamp. I will put the link in whatever note section is necessary here. It is $47 to join for the 4 days. It'll be probably 30 to 45 minutes each day, a lot of handouts. Replays will be available as well if you're not available on the 11th, 12th, 15th, or 16th. It'll be there. And I do have an upgrade available too. So it's $47 to get all the trainings, the replays and things like that. If you do want to stick around a little bit more and attend live Q&A sessions, question and answer sessions with me too, I'll be offering an upgrade. Basically, it's $30. So it creates it's like $77 total for the boot camp. And on the Q&As, you can submit your questions ahead of time. I will be answering them to as best as I can with great detail. And you also get the opportunity to submit your blood work to us ahead of time. So I will take a look at it and I will review it. I can keep your information private, like your name and things like that private. but I will review it live on those Q&A sessions as well. So you can get really good feedback and analysis of like, what does it look like in real time? So I'm very excited about both portions, both the teaching portion and as well as the Q&A. We're going to call it like a VIP portion where we're doing the Q&A and the blood work review session. Again, if you want to learn a little bit more, I have more details over at flourishaftercancer.com/bootcamp, and you can sign up over there if that is of interest to you. I do hope to see you. But for today, next time, if you feel like something didn't work, I really want you to remind yourself that it's not a failure, it's a data point. It is something that you're learning and it is still important information. If something didn't change, it's still important information. It is how we create a plan. It's how we teach your body to fish. It's really getting you closer to what's best for you and helping you to reduce your risk of cancer coming back. And if you do have something that comes back, great. Don't forget to celebrate because that's very important as well. Thank you so much for joining me. I'm Dr. Megan Bernard, and here's to you flourishing after cancer. Thank you so much for joining me today on the Flourish After Cancer podcast. If you loved this episode, please be sure to leave a review and subscribe so you never miss an episode. Sending all my best your way, Dr. Megan.